So my name is
Yeah, you
Monika
can start your
Jakubcova.
presentation. Yeah,
I'm from Slovakia, but my last 5 years I'm working in Saudi Arabia. So I did the short research about international nurse migration because I'm working with the nurses with many nationalities from all over the world, and I was interested why they migrate. Was the main reason. So in my summary, I just want to say the migration is the movement of people to a new area or country in order to find work or better living conditions. People migrate for a variety of reasons: to escape oppressive political climates, to pursue better economic opportunities for themselves and their families, to better for education or those for their children, or even just for adventure. But my question was, why do nurses migrate? Why we have to migrate for anything? I wanted to find a reason. Because we have families, friends, known environment around, stable job position back home. But unfortunately, I found out the nurses are not happy in work in home country due to many reasons. And I was trying to find these reasons. The aim of my short research work was to find out was the main reason of migration of my colleagues, the nurses who came from all over the world, because I work with the nurses from also Europe, then from America, from Asia, like Malaysia, Philippines, India. Also I work with Saudi nurses. So, and I spoke also with the nurses with the same nationality as me. I found that a lot of addressed had problem to answer truthfully my questions, but the main reason for migration was the same for all nationalities. It was dissatisfaction with salaries. So what is the problem of my research? The problems become when the number of migrating nurses grow up until the countries have to face up the problems with the nurses shortages in hospital, and whole healthcare system starts to have problems too. Because the ratio of patient to nurse increases, and it can lead to serious consequences. For example, if the nurse who takes care of 3 patients normally has to take care of 6 patients now due to nurses shortage in hospital, what care does the nurse give to the patient? What is the care? Did somebody ask the patient how the patient feels? Because we are facing now problems in my country back home that a lot of nurses migrate, and we have really serious problem in hospital, and the nursing care is worse now. Because the nurses will become more tired, because they are taking care of more patients, there is more stress and pressure on the nurse's head, and it's very easy to make serious mistake in giving health or nursing care. For example, we can give wrong halal medications, we can mixing medication, we don't have proper time for the patient, we have not enough time for proper education, and education not even patient but the families also, which one is very important. Not appropriate assessment even during admission, but also each shift. There is no time for that, because if the nurse handling more patients as usual, it's really getting worse. The method which I used was quantitative method questionnaire with 15 simple questions, where I try to find out how many times my colleague migrated, how many years they work abroad, if they want to come back and work again in home country as a nurse, and the most what I wanted to try find out was the main reason why they left. The questionnaires was given to my 50 colleagues of different nationalities, as I said, and 48 was returned. Okay, this is my results, what I found out. So my first result was that marital status doesn't fulfill role in nurses migration, because 44% of my colleagues is single, 48 is married, 8% is divorced. Another result is that nurses migrate abroad because of work for a few years, not forever. Not nurses, no one wanted to stay somewhere abroad forever, because we have family and friends back home. Because I asked how many years have they worked in Saudi Arabia, and 54% asked it's just maximum 5 years. Then 36% answer me 5 to 10 years, and 10 and more years answer 10% of my colleagues. The other question was how much longer they are planning to stay working abroad. So 77% of my colleagues answer 0 to 5 years maximum. The 15% of my colleagues answer 5 to 10 years, and 8% of my colleagues answer 10 and more years. Another result, what I found was nurses migrate mostly just once, or my colleagues, because I asked them how if they worked abroad before, and only 21% say yes, 79% answer no, they never worked before. So my result is from this question that they just come to one country, they get what they want, for example money, get experiences and other things, and they are returning back. Another question or another reason what I found was the main reason to migrate. So I found out the main reason was dissatisfaction with situation in home country. In the first place, 90% of nurses answer, of course, they came abroad because of better salary, more benefits, and for example, 4% answer to meet new people, 2% answer to get different work experiences because we are in different country, 2% answer to see different culture because Saudi Arabia, yes, it's different culture, and 2% came here because of religion. Another reason what I found out is that nurses are happy and more satisfied abroad, because I asked them if they meet their expectation, and of course 73% answer yes, 27% answer no. Then I found out that nurses really want to come back to home country, because I asked them if they are planning to come back home and work as a nurse. 65% answer yes, 35% answer no. Another reason what I found out was if the situation in healthcare system change. Yes, because 52% of my nurses notice there is changing in their countries also since they left. 48% have no idea, or they don't care, or the answer just no. Another result what I found out is the government don't do too much to get nurses back to home country. I asked them if some hospital or government offered them any new job in the country recently, and 62.5% answer no, they didn't get any job offer, so they don't feel motivated to come back home. So my possible solutions to solve coming problems done by nurses migration could be if the nurses start to feel more support from home country, from government, from hospital, from people, for example. If they have more support regarding education, benefits, salary, even new working environment, new equipment, for example, they feel more motivation of the nurses and even the students of the nursing, because I did some presentation also in the nursing college, and I can say 90% of the nursing students don't want to even start working home. Everybody wants to migrate abroad because they hear there is better benefits. So I think this one needs to approve from College of the Nursing. This is my references. I just used a few websites. So my conclusion is that the nurses will be still migrating until they will be happier in home country. As Dr. Kingma says in the book, nurse migration would not be such a big issue if there wasn't a nursing shortage. Migration is and will continue to be a part of our lives, especially with increasing globalization. If we deal with the need to migrate, we will address the nursing shortage, and migration will be not an issue, it will be an enrichment. So now I'd like to say thank you, everybody. I hope you enjoyed. Thank you.